Thanks very much. Well, I thought it might be worth starting with some of the larger context, which is why are diabetes rates rising in cities in particular? So I wondered, Dr. Foreman, do you want to just start by talking a little bit about what are the factors that is contributing to this problem, especially in urban areas?
I think we've heard a lot already, but I think just mere urbanization is really making us all vulnerable to diabetes. Being in large cities where people may be living in environments where they have food deserts, not places where they can actually get fruits and vegetables. The busyness of life, we have to barter time on a daily basis in urban areas trying to get to and from work. We spend a lot of time in our cars. Certainly in Houston, we don't have great public transportation like you have in a city like New York. So we spend a lot of time in cars, so we're less active than we need to be. So I think all of those factors, including just general poverty issues that we have in urban areas and isolation for different communities, are all contributing to the increase that we see in prediabetes and diabetes.
Are those the same factors you find in Philadelphia?
Yeah, I would agree with Dr. Foreman. We are seeing the impact of the toxic food environment coupled with poverty. In Philadelphia, we do have good public transportation. We have about 30% of our residents who don't have cars, though. And if it's going to be 2 or 3 different bus rides to get to a grocery store, that can be a real challenge for people. And the fact that our cities really were designed around the car, so rather than being designed for pedestrians or bikers. So the city design, as it was at least before interventions, didn't necessarily encourage active transportation. Meaning both use of public transportation because you walk back and forth at both ends, and walking and biking.
So are you saying is public transportation actually, if you have more public transportation, does that mean you're likely to have less diabetes? Or are you suggesting that actually because the cities are not designed for public transportation, that actually even taking public transportation doesn't necessarily help that much?
So just to clarify, public transportation does help because we know that people tend to walk more when they take public transportation than when they take their car. And I think all of us know that because when you get in your car, you just hop right in your garage or driveway or on the street. But it's the design of the cities around the car that tends to decrease walking. And it's fairly simple. If you imagine yourself, and especially if you're, say, a senior and maybe not, or you have a disability, you're not rapid at walking, and you have a choice, you're going to go somewhere half a mile away. Does it feel safe to walk there? Are you going to have to walk across a busy road that maybe doesn't have enough time at the light for you to get there? Are the sidewalks actually open? In Philly, we sometimes have issues with construction closing our sidewalks. So that design around the car is also a big factor, even with a good public transportation system.
Dr. Foreman, can you talk a little more about food deserts? Why do we see them? What does it take to try to close them?
Right, so in a country like ours, you would think that food is plentiful by some of our waistlines that we have, and the problem that we have in obesity. In Houston, 32% of adults are obese. Wow. So you wouldn't think we had food deserts, but food deserts by definition are places where you cannot access a grocery store within less than a mile without taking public transportation. And so many large cities actually have neighborhoods where people, their only choice is the corner store. And so when you create an environment, or fast food, so when you create an environment where what we call in public health, the healthy choice is not the easy choice, or the easy choice is not the healthy choice, then you create an environment where it's called a food desert. So you have a utopia of unhealthy food, but you have a desert of those things that we know are better in terms of our nutrition. And those things contribute. We know nutrition is a key factor in the development of diabetes.
Dr. Bettigole, I know one of the initiatives you've worked on is with farmers markets and trying to get SNAP used in farmers markets more. Right. Can you tell me a little bit about to what degree farmers markets can be an answer to this food desert problem?
Well, they're a piece of an answer. And like Houston, we've also used a Healthy Corner store network to try to supplement that as well. But farmers markets, they help a little bit in terms of actual access to fruits and vegetables because with encouragement, we can get them to move into some of these neighborhoods that really are food deserts. More than that, though, they help as a place where people who might not otherwise have tasted a particular kind of fruit or vegetable fresh from the farm, because they taste different when they're fresh, right? They're much more attractive. If you've only been to a big grocery store and gotten iceberg lettuce and some wilted vegetables, if it's not a high quality grocery store, you may think you don't like certain foods. Similar to the school lunch discussion earlier, if you've only had your vegetables boiled and pre-plated in some site miles from your school and then stored for a while, you think you don't like them. So farmers markets offer people an opportunity to try something new, and a lot of them do have tastings and educational sessions so people can find out this is something that actually is really good and you like it.
And talk a little bit about about the program vis-a-vis SNAP and the farmers markets.
Sure. So, and there are similar programs to ours. We call ours Philly Food Bucks around the country. So, in our program, if you have SNAP and you spend $5 at a farmers market, you can get, it's basically like a voucher, but a $2 food buck that you can spend at a farmers market. And you can spend it that day. You can spend it another day. There's actually a pilot to try this out in a grocery store and in a corner store, which is really interesting because, as I think we're probably all aware, farmers markets can only be a piece of the answer because they're limited in terms of time. They usually are, in a given location, maybe one afternoon a week, and we don't have them in the winter and the late fall and early spring. So by piloting this in a grocery store and a corner store, it's a chance to see, can it work on a larger scale?
And I wanted to add, we also have the same program in Houston around SNAP and farmers markets. And what we've done to really, because the thought that if you build it, people will come sometimes. Right? Not really, because you can offer a lot of things free to people, as we know, and they may still not show up. So what we've had to do is to really leverage almost every asset that we have in public health. And because we are also the WIC locations, and I heard someone mentioned WIC earlier in the discussion, on the locations where the WIC recipients come to receive their WIC benefit, we actually put the farmers market there at the same time. So we're kind of like stacking. So you stack all of your benefits in an environment where it makes it easy for those moms who may be receiving that WIC benefit or SNAP benefit as well. They can use those benefits at the same time. Their children are there. It exposes the children. So it's almost, we in Houston, we believe in wraparound services. That means at every point of entry, you're trying to really make that healthy choice, that ideation of the thought around making a different choice in one place easier for our patients and the people, the people in the community. So if we can give you an immunization, we can give you a flu shot, we can give you anything within that setting, including exposing your children to, fresh fruits and vegetables or tasting or experiencing a farmer's market. We'll do that at a WIC location as well.
And tell me a little bit about the work with the corner stores. How difficult is it to get corner stores? Presumably, they're used to selling what they're selling, right? And so it's not intuitive to them necessarily. They put all these fruits and vegetables out there. People are going to buy them. So how do you work with them and incentivize them to get them to start selling stuff that they haven't sold, or maybe they tried selling and it didn't sell?
Right. So it takes a lot of work. It takes a lot of engagement initially with a store owner, education about principles like what we call CEPTED, creating environmental or reducing crime through changes in the environment, letting them know how we can go in and help them with points of placement and where to put produce and the benefit to them and also to the community. So we've been very successful with some of the smaller stores in the Houston area around healthy corner stores, but it has not been easy in that regard because you do have to do a lot of education. You have to let people, the owners know that it will be beneficial. And in our program, specifically in Houston, they can't keep the fruit and vegetables on the shelf. Oftentimes, once it gets, picked up or uptake, then people immediately come in there because they know, hey, on my way to school, that kid can run by the store and grab an apple or a banana, and we work with them to reduce the cost and working with local farmers. So there are several strategies that have to be put in place, but I think the best piece is education and really helping them create that type of opportunity in the community. And you have to find the right store owner. And that's all about community engagement. You can't just go into a community that doesn't know you. You have to be a friend to the community if you want them to work together with you on strategies that they may not be familiar with and may not think is going to be beneficial to their bottom line. And we know they're in business to make money, but also at the same time you have a lot of retailers that care about the community, and through education you can get them to do it.
And what have you learned about which fruits and vegetables are easiest to get people to eat and which are harder? I wonder if it's different in Philadelphia and Houston.
I would bet that it is. I think it's different in different neighborhoods in Philadelphia. So we've done a lot of our corner store work, really all of it, in partnership with the Food Trust. And you know, our strategy as a health department is to work in partnership with community organizations because they can really extend our reach and they know the issues. So, you know, a store in one neighborhood may do really well with broccoli and apples, and another store it may be, you know, greens. It just depends on the neighborhood. But they provide the technical assistance to help the store owners to figure that out.
And culture, you know, whatever that community's culture is. I mean, you can't go in and offer something that's not culturally relevant for that community. So you want to make sure any intervention you do in public health or in healthcare has to be based in cultural and linguistic relevancy for the community that you're working in. So I think that probably is a driver to what types of fruits and vegetables. I've never had that question, but that's good.
And Dr. Bettigole, you specifically said that you're targeting the Latino population in Philadelphia. And I wonder, and Dr. Foreman, I know Houston has a significant Latino population as well. I wonder what particular challenges, opportunities there are in dealing with this increasingly immigrant-driven community.
Well, so we're particularly interested in figuring out ways to offer physical activity opportunities to the Latino community, because when we looked at our obesity data among school children in Philly, Latina girls are the population that had the least improvement. So, you know, because we're seeing improvements in other groups, which is really encouraging, but that group is lagging, we're trying to figure out, you know, how do we address that group? Now, part of what we've done is to create a database and a media campaign around physical activity. We also had a sort of a summit, like bringing together community groups from the city to talk about what do we think the issues are. And of course, you know, the issues from people doing work on the ground with kids are pretty diverse. You know, they don't want to get sweaty. They don't have sneakers. They don't believe physical activity is something girls should do. You know, often there's issues on playgrounds of the boys are playing basketball and the girls feel like they can't go in. You know, so somebody suggested, can we paint a basketball court pink, you know, to designate it. There's lots of innovative ideas going on right now. But I think it's really important to think about what are the sub-communities within the city and what are their challenges. And that process has been good, I think, in terms of trying to resolve those.
Have you had any particular experience with the Latino community or other?
Absolutely. You know, Houston, we're very diverse. I mean, and so the goal is always to make sure that we're addressing community issues that are important to the community. So we find we've been very successful at using community health workers and promotoras who are lay leaders in the community who can put that health message out there for us. So using you know, those champions in the community who live and who are there on a daily basis, particularly in Latino communities, is very successful for us. We use and partner with community health workers to do everything from diabetes self-management courses, chronic disease self-management courses. We have several lay leaders for those classes that are actually in those communities, and they're leading both in Spanish and English classes around chronic disease self-management, diabetes self-management. So it's been very successful, and we have a large, very diverse population in Houston. So we must utilize every resource that we have in the community.
I know Houston's not a city necessarily where it's that easy to walk around in some places, and so you've been working on trying to close down streets in certain areas to create an environment for walking. Can you tell us a little bit about that?
Yes, and actually we have a very big initiative called Sunday Streets in Houston, and it's really based, it came out of Bogota, Colombia. Actually, it's based on the Ciclovia concept, where you actually shut down the streets to vehicular traffic. And then you open the streets to what we call active transportation, and that is for people to walk, bike, skate, dance, run, and do whatever you want to do. We do this one Sunday a month in Houston, and this is a very big deal for a city like Houston because we love our cars and our trucks and our 4x4s and all that good stuff. But we actually shut the city down for 4 hours. The set shut down a particular portion of a street in very high traffic areas for 4 hours, and then no one can drive during that period of time on that part of the street. Our largest Sunday streets activity has been about 2.5 miles of street that we've closed. And during that 4 hours, we're really strongly encouraging Houstonians to come out, those people who live in that neighborhood, as well as folks who live in other neighborhoods, to park their cars and be active. And what we found is if you actually participate in Sunday streets and you're out there for 4 or 5 hours, you can theoretically get your week's worth of physical activity, 30 minutes, 5 days a week, just in that one Sunday afternoon. So it helps to promote that, but it also helps, I think, on a larger context. It has two goals. One, to really get people active and to use active forms of transportation, but also, number two, to let the community know in a city where we're so into driving our cars, that the streets are indeed safe and can be safe places, and that the streets are actually for people as well as for cars. And so it gets to better design and really makes families feel like they could actually get in. I always tell them, come play in the street. Now, we do a lot of social media. We do a lot of build up. We're walking the streets, working with those retailers. It also allows the community to actually get to know the businesses, because the businesses along that stretch of territory that we shut down are all involved as well. So you work with them because the key question is going to be, you're going to shut down traffic to my location and people are not going to be able to get in and purchase my goods. But what we found is that the retailers actually like it, because how many of you have ever driven somewhere and you live in an area and you're constantly driving by it, but if you walk by it, you see it differently. When you're driving by it, you don't have a chance to stop. You risk running into someone. But when you're walking by it, you actually get an opportunity to go in and really see what that business has to offer. So we do Sunday streets, and it's been a very key concept, so much so that we started it as a pilot with some CDC funding under the Community Transformation Grant, and now we have a title sponsor for Sunday streets. So the city no longer has to pay for it. So it doesn't come out of my budget anymore.
And what do you find about, obviously Michelle Obama has made this a centerpiece of her, time in the White House. To what degree do you see that kind of filtering down culturally, that message? What kind of sense have you gotten of what the impact has been of what the federal government's been doing?
I think it's been really useful. I think that the biggest impact, as far as we're seeing it, is in schools. That there really are very real changes happening in terms of the nutrition of the food that's being fed to kids in schools, but also kind of out of the box thinking about, well, how do we get kids thinking about being active and healthy food? And I think it's helped to kind of nudge some of these programs along. There are programs in Philly and probably in Houston as well to bring farmers in to schools, to get kids thinking about cooking. We have a cooking contest in our schools, which is when we have youth wellness councils in the schools, and the kids take part and think about what they want to eat, and then the winning recipe gets incorporated into the school lunches. But there's some changes happening there, and I think that that's a big piece of why we're starting to see obesity in kids level off, obesity in teens level off, is that kind of culture change, which it's easier to make something like that happen in schools because kids all come together. And so, with adults, we're much more fragmented, but the schools really offer an opportunity. And I think the Let's Move campaign has been really great. I also think that the icons used for that campaign are easy for people to understand, and certainly we've used them. We put them with our vending machines. So the city owns hundreds of vending machines, and we have nutrition standards for our vending machines. And we realized that in order to get people to kind of not just have to follow them, but understand them, we needed to have some kind of point of purchase reminder of why does my vending machine suddenly have all this water in it and not have candy and that sort of thing. So we use the Let's Move images for that.
And what is it like dealing with the food industry? I mean, how easy or difficult is it to work with them in order to find ways where they can still, make a profit, but maybe not make a profit by selling, candy bars to fourth graders?
Well, I think, as from a city or government standpoint, as was mentioned, we have the ability to make contracts with companies, and we too have a vending policy in the city of Houston, and so we can require certain things if you're going to be our contractor. And we went to just recently in Houston 50% healthy vending in our machines, and in all health facilities or health department, we're 100% healthy vending. So, which includes the wrap on the machines. So versus a sugar sweetened beverage wrap, it must be a 0 calorie or diet wrap on the machine. So you can't even have that advertising. So there are ways that you can do that through your ability to make contracts with food industry. So policy is definitely one way. I think another way is many companies have community engagement and community service lines of business, and they want to do great things in the community. So you can partner with, it's not that, we in public health cannot work with large companies. We know that they have to make a profit, but they also have community responsibility. They have community giving. So there are opportunities for them to support children's programs and children's nutrition programs. So I think there are ways to do that where you are not affecting their bottom line, but also making sure that we are all good stewards of our community and that we are promoting healthful communities by partnering to do that type of work.
So, just to add in, so we are doing very similar work. In Philly last year, the mayor issued an executive order making all city food required to pass certain nutrition standards. And what that means is that as contracts turn over, that's when that requirement kicks in. So we're in the process of working with vendors around these issues. The city as a whole, because that includes so many different kinds of facilities, including prisons, including the city nursing home, and so on, it's 20 million meals. So that's enough leverage that it does make the food industry willing to because we can issue an RFP, but they need to respond to that. This is when we put out a request for a contract. There are definitely opportunities to make this easier. One of the places this has come up, it's not so much around diabetes as around hypertension, but we're doing a lot of work to try to lower sodium in the diet. When we're working with local takeout Chinese restaurants, this is an oddly specific issue, but noodles have a lot of sodium. And we have not yet been able to find a noodle maker who will make a low sodium noodle. But we've been told that if another city would also do this, then that would work. And I think that as more and more cities start thinking along these lines in terms of policy, it's going to get easier for the food industry to meet those requirements.
Well, let's open it up to you, to questions. I don't know if there's someone with a microphone. There we go. I see someone. Go ahead.
Hi, my name is Sonia White, and I'm from Team Up for Wellness. It's a nonprofit organization that I started. I'm a personal trainer and a recent graduate with the Masters of Public Administration. And I've done a little bit of research. I'm from the Newark, New Jersey area, and I know diabetes, and both my parents have diabetes. My niece has diabetes. And so there was some research done in terms of the farmers market. And what they found is that, in Newark specifically, the education piece of it, like what do you do with the fruits and vegetables that you get? And also, it became an issue of, okay, how do I store it? Because some folks don't have the proper, space to allow them to store the fruits and vegetables. So I'm always interested in the waste in terms of, I get these fruits and vegetables, the shelf life is really short, and I think sometimes we might wind up wasting a lot of that. And if you don't know quite what to do with it and how to cook it, it becomes a big issue. So I think what you said before, from the Houston, yes, the director.
Dr. Foreman.
It really comes down to education, and I think and breaking that culture. So if you can kind of start in the school system educating the children on, better healthy eating habits, and then that hopefully will spill over into their homes and bring that information home to their parents and with new ideas of how to eat better. So I'm very interested in the waste of the food and also the education piece on how to prepare it. So I think with those two, that could possibly be
Either of you want to respond?
So thank you so much for that. I think you're dead on with, there is a potential for waste, but I think the key is, and there probably, I know not probably, but in Philadelphia, all around the country, there are programs where we're sending home fruits and vegetables in bags with kids. That's a very good way to get introduce fruits and vegetables into families. And along with that bag of food comes recipe cards, education about how to cook those things, how to prepare. Not just take home, but any good public health or nutrition education program is going to offer cooking classes, meal planning, grocery store tours. These are all strategies that any community should be using, and that will help to reduce some of that waste. So offering those cooking demonstrations, classes for families, those living with diabetes. At our diabetes center in Houston, we offer regular cooking classes on how to prepare those vegetables. We have a grocery cart, so they could, the members of the diabetes center can actually purchase the fruits and vegetables at a very low cost there, and then we also teach them how to cook them, and how to prepare them. The one thing I wanted to say, and this may be a little tongue-in-cheek, but a way not to have waste is to eat them, and the recommendation is 5 to 9 on a daily basis. So I say eat them all, put them all on your plate, make a vegetable plate, but certainly being educated on how to introduce new fruits and vegetables into families is very important. And you have to, these dietitians will tell you, you must introduce something at least 8 times to a child in order for them to uptake it and want to, to eat that on a regular basis.
Go ahead.
My name is Marie. Hello, can you hear me? My name is Marina Tsaplin. I'm the founder, executive, and artistic director of the Beatties organization. My laptop just fell. I want to ask you about the value of mental health in partnership with nutrition programs, which I know is maybe a stretch, but I haven't actually seen something like this. And depression in the diabetes type 1 and type 2 community is a huge issue. It's a national crisis. It's a world crisis. So have you considered partnering nutrition and mental health community education programs together, and you can hit both sides of an overall wellness initiative?
Absolutely. So we, at our diabetes center in Houston, we have, it's called DAWN, it's called the Diabetes Awareness and Wellness Network. We actually call it the Diabetes Country Club, because you can kind of go there if you're a diabetic or pre-diabetic, and you can get a wraparound service. So diabetes is comorbid with so many things, and mental health is one of those things. We have considered it, and we incorporated it into our behavioral model. We have diabetes stress, diabetes yoga. We have diabetes, we have coaches, therapists there in our diabetes center. So if you are a member of DAWN, you have full access to all of the case management services, including mental health services. And we offer classes specifically around yoga, stress management for people who are either pre-diabetic, living with diabetes already, or a caregiver who is working with a family member. So yes, very important, and we certainly have considered it in Houston.
Go ahead.
Hi, I'm Gail Melkis. I'm from NYU.
You want to just wait for the mic?
I'm Gail Melkis. I'm from NYU. I'm for many years a diabetes nurse practitioner and nurse scientist, and I've heard a great deal of focus on food and some on physical activity, and then also some physical activity initiative that's for hypertension, but wasn't necessarily mentioned for diabetes. So given that obesity, prediabetes, and diabetes are insulin-resistant syndromes, and while food matters, physical activity may matter more, and what could we do nationally to have an agenda more on increasing physical activity and creating environments for physical activity? As well as thinking about comorbid conditions, because people with diabetes do have hypertension, they do have asthma. And in my own research experience, what happens is that patients and families don't know how to prioritize, because we silo our care and our initiatives. There's diabetes provider, there's diabetes initiatives, there's hypertension, there's asthma, there's hep C, but the people with these conditions have them all, at least up to 3. So I wonder what you're thinking about some of that.
Yeah. So in Philadelphia, there's a couple of different approaches that we've taken to that. And we do see physical activity definitely as both preventing diabetes and as a way of helping with treatment. But so part of our approach within the Philly Health Department is around integrating the design of the city into our prevention work. And we actually, my division has a shared employee with the City Planning Commission. There's a plan for the city called Philadelphia 2035, and health is built into that plan. Actually, some of the district plans have health impact assessments built into them as well. What that means is when they're looking at different parts of the city and thinking about public transportation, thinking about new businesses, thinking about parking lots, they're thinking about, well, how do we integrate the need to be more active into the design of the city so that the default option is something that makes people more active. So what that translates into is making sure that we have bike paths and that they're not just like right in the middle of traffic, but that they're kind of sheltered from traffic, that we have good places to walk, both walking paths, and that our sidewalks are wide and easy. It's funny little interventions I had never thought about before, like bump outs at intersections, which means that if your street comes down like this, at the intersection, the street actually gets narrower, so that if you're not somebody who moves quickly, you feel safer crossing that. It's countdown markers, which I noticed in New York you have at some but not all intersections, which kind of puzzled me. But so you know I have 20 seconds left to get across. If you're slow, you know if you can make it or not. So there's a lot of design elements like that. There's also a lot of work around greening in Philadelphia because we know that there's connections between health and green space that kind of transcend the rest of what we're talking about. And then beyond those design elements, we're also in the midst of an 18-month campaign to try to get people more active. And it's built around the stories of 10 ordinary Philadelphians. They're adults, because we're really gearing this piece of the campaign around adults, but telling their stories of how they managed to fit being active into busy lives, people who are working, people who are parenting, or caregivers. Not models, but ordinary people telling their stories. And then we've created a database of free and low-cost ways to be active in the city that is linked through a website, and are promoting that on traditional media and social media, trying to work that in with our work around design in the city. Because unless we change that piece of things, we're not going to get where we need to get in terms of preventing diabetes, preventing obesity.
Great. This may have to be the last question. Go ahead.
Morning. My name is Hannah Hamdi. I'm the health director for the city of Newark. It is the largest city in New Jersey, and by virtue is the largest health department in the state of New Jersey. So my question is more so systemic. How do we deal with community food insecurity? How do we deal with overpriced food prices in communities like Newark, particularly when they're struggling to make ends meet? And the options are canned foods, canned vegetables. Rarely do we see farmers markets because of fear of violence. If you can just speak about those systemic issues.
So we could have a little difficulty hearing you, but I think I heard you mention about food insecurity and the lack of available fresh foods, canned foods, and then also the not having farmers markets because of maybe crime and fear of those things. Am I correct?
Yes. So
okay, I just want to make sure.
Individual, family level, food insecurity, but community level. We have 1 in 5 children who go to sleep hungry, basically.
Yes. Right.
So in discussing diabetes, how do we discuss individual and change of behavior? We have these systemic issues that are overwhelming the families.
Right. So one of the things that what we found in Houston in mapping this whole diabetes issue is that it must, and it requires a multi-sectoral approach. Everyone's responsible. So from your juvenile, your justice system, the police department, to the corporations that can help provide your food banks, your faith institutions. Everyone has to be on board to help make it less, scary to be out and have a farmer's market. Engaging farmers. In Houston we have, and I'm sure you have, agricultural extension agents or services where they can help with creating opportunities for farmers markets to come in. So it has to be multi-sectoral. We too, in Houston, will deal with issues of crime. So I totally understand what you mean when people don't want to come out to a farmer's market, but that means you have to really, truly work together with every sector of the community to make that happen. It takes a lot of work on the front end to build that type of environment, but it is doable. Involve the community. They know their community. They know what's happening. So leaders in the communities have to also be involved to help. There's always a champion. There's always someone who's in charge. And it really takes that multi-sectoral approach. That's the best quick answer I can give, given the time. It takes everyone to create that type of environment.
Please, Dr. Pepper.
And I just want to add, and I, by the way, think that's the core issue here, that in addition to the great comments Dr. Foreman made, that making sure that everybody who's eligible for SNAP has SNAP is a piece of what we're working on. But beyond that, I think there are huge issues of the cost of food and the cost particularly of healthy foods in this country that we are not going to solve on a citywide level, but that we could solve in the Farm Bill. You know, if we subsidized fruits and vegetables instead of subsidizing corn, we would be in a very different place in terms of affordability of healthy food. Yeah, and also I'm a family doc, and I've seen patients for years who have told me, you know, I tell them to eat fruits and vegetables, and they tell me what's in their fridge. White bread, mayonnaise, mac and cheese, right? That's what they can afford. So until we make it affordable, I don't think we will really get where we need to get.
Well, on that note, thank you very, very much, Dr. Bettigole, Dr. Foreman. And I'm going to hand it over to Mary Louise Kelly.